International Nurses Day is celebrated every year worldwide on 12th May, the birth anniversary of Florence Nightingale. Florence Nightingale is acknowledged and revered as the pioneer of modern nursing. WHO's landmark announcement that 2020 as the International Year of the Nurse and Midwife provided an important opportunity to advocate to strengthen midwives and the midwifery profession, which coincides with Florence Nightingale's bicentennial. National Florence Nightingale Award carries a medal, a certificate, a citation and also a cash award of Rs 50,000.
Smt D. Roopakala is working with Satish Dhawan Space Centre, Sriharikota, Nellore, Andhra Pradesh for the past 12 years. She has been certified as Lifesaver by undergoing basic life support training and certified healthcare Lean 6 Sigma Green Belt. Roopakala has worked in operation theatre and labour room in the hospital and is able to handle emergency and life-saving equipment and devices. She has conducted various midwifery cases in the tribal community safely. She has assisted in saving lives of accident victims. Dr. A. Padmaja, with 35 years of experience, has 10 years in nursing service and 25 years in teaching. She is a well-accomplished educator and is currently working as Professor, Vice Principal, College of Nursing, Sri Venkateswara Institute of Medical Sciences, Tirupati. She is a PhD, guide, and is author of 2 books and has several publications to her credit. She has conducted cervical cancer screening for 600 people and self-breast examination camps for 3,015 people and motivated 151 organ donors from the community. Srimati Rubu Yape is working as a Senior Nursing Officer, Nurse in Charge of Operation Theatre in Tomoriba Institute of Health and Medical Sciences, Arunachal Pradesh. She has also worked in critical care areas and has a total of 27 years of experience. She was actively involved in Quality Improvement Project for Arunachal Pradesh in Operation Theatre Services of the hospital and has taken special training in Intensive Care Unit, Anesthesia and Neonatal Care. She has received letters of appreciation for her exemplary services in planning and setting up the Operation Theatre block by the hospital administration. Ms. Rajila Roy is a senior nurse who has worked in pediatric units for over 2 decades in Mahendra Mohan Chaudhary Hospital of GMCH, Guwahati, Assam. She has also worked in emergency and COVID-19 screening areas. She has also worked in Community Health Centre. Ms. Rajila Roy was awarded with Certificate of Outstanding Performance in the hospital. Ms. Renju Kumari has a total of 21 years of experience in Bihar Health Services. She is working in Primary Health Centre, Bhagwanpurhat, Siwan District. She is a skilled birth attendant, trained, and particularly in postpartum intrauterine contraceptive device training. She efficiently contributed to all the primary health centre activities and all national health programs, especially maternal and child health, family planning and immunization. Ms. Bandana is currently working as a Senior Nursing Officer in Sadar Hospital, Jagatpur, Banka, Bihar. She has also worked in a primary health centre for 8 years. She was considered as a high-impact leader. She is a master trainer in quality improvement and has contributed to the process of national quality assurance at national level. She has received recognition for innovation for change in service. Shri Ajay is working as staff nurse in Orthopedic Operation Theatre in Government Medical College and Hospital, Chandigarh. With more than 2 decades of clinical experience, he has the ability to handle emergencies. He has worked as a voluntary member of the Earthquake Relief Team in Kutch, Gujarat at base camp and has played a major role in setting up and running Operation Theatre in addition to assisting during surgeries. Dr. Mrs. Daisy Abraham is a dynamic teacher and has varied experience in clinical areas as well as teaching with 27 years of total experience. She is currently working in PG College of Nursing, Bhilai as professor. She has developed teaching materials, published research articles. She has been a master trainer for neonatal resuscitation. Dr. Mrs. Daisy Abraham has received letters of appreciation from local authorities for her dedicated clinical services and Best Nurse Award in 2018. Srimati Samdar Janu Kamdi has worked almost 30 years as A&M and has been providing excellent services in maternal and child health, family planning, immunization, reproductive and child health, pulse polio and national health programs in Primary Health Centre, Mandoni, Dadra and Nagar Haveli. Srimati Samdar Janu Kamdi has received appreciation from CMHO Primary Health Centres and from Administration of Dadra and Nagar Haveli, UT. Victoria Elvira Noronha, with 26 years of experience, has provided valuable and remarkable services in regard to maternal and child health, family planning, reproductive and child health, HIV/AIDS, tuberculosis, immunization, and non-communicable diseases in Daman and Diu, UT. She works in Primary Health Centre, Moti, Daman. She has been appreciated for her excellent work by UT Administration of Daman and Diu, and Asha Women's and Damini Women's Foundation. Ms. Sonia Chauhan, a senior nursing officer working in Apex Trauma Centre, AIIMS, New Delhi, has 13 years of experience. She has undergone additional education in MSc in Counselling and Family Therapy, Fellowship in Emergency Nursing and Postgraduate Certificate course in Hospital Management. She has been actively involved in various academic activities, research studies and projects in trauma care of AIIMS, New Delhi. She has been awarded AIIMS Sonians of America Award for the Best Nurse 2018 and Best Nurse in Research Work 2010. Ms. Sonia has earned letters of appreciation from Trauma Nurses Society of Thailand for being International Trainer Faculty 2019. Ms. Shashibala Kalra, with more than 35 years of experience, is currently working in Arunachal Hospital, New Delhi. She contributed in the entry screening of international passengers for H1N1 at Indira Gandhi International Airport, Delhi 2005, care of Delhi serial bomb blast injuries victims 2005, and care of victims of collapse of civil construction structure near Arunachal Hospital 2009. She played a significant role in establishment of intensive care unit of nephrology and renal transplant and converting the same into coronavirus ward and initiating the care of patients in 2020. In 2018, she participated in non-communicable diseases screening and awareness campaign India International Trade Fair under Swasth Chetana and Jan Samparka Abhiyan. Ms. Usha Rani Ahuja is working as Senior Nursing Officer with 34 years of experience in Cardiac Care Unit of GB Pant Institute of Postgraduate Medical Education and Research, Government Hospital, Delhi. Starting her career as Auxiliary Nurse Midwife, she has completed BSc Nursing as well as MBA. She was actively involved in establishing continuing nursing education cell in the hospital. She has received WHO Fellowship in Intensive Cardiac Nursing in Washington, USA. Brig SV Saraswati has a distinguished service in military nursing service for 3.5 decades, especially in peri-operative nursing. She is a renowned operation theatre nurse and has assisted in more than 3,000 life-saving and emergency surgeries. She improvised drape kits and suture packaging for cardiac surgery. She has displayed exemplary professionalism and dynamic leadership qualities by saving 45 women and 12 newborn during a fire mishap in maternity and childcare wards. Brig SV Saraswati has been awarded JOC INC Commendation, Chief of Army Staff Commendation and also United Nations Medal by Congo. Geeta Chandrakant Salgaonkar has 21 years of experience in rural health field. She is currently working in the sub-centre Batora, Goa. She actively contributed for achieving 100% institutional deliveries. During the outbreak of dengue, she actively participated in its control in the areas she was serving. Her sub-centre was recognized as the best performing centre by WHO team during the year 2018-19. Her participation in case finding of TB and leprosy is commendable. She helps villagers to develop innovative projects such as construction of fish hatchery in view of non-accessibility of fish close to village. Shri Prashant Gunu Devidas is working as a nursing officer at Community Health Centre Goa with 28 years of clinical experience. He has actively participated in all national health programs. His special inclination to identify and help patients with kidney failure in the community is commendable. He has contributed immensely during disaster situations arising out of cloud bursting and building collapse, and he demonstrated impeccable work ethics throughout. Ms. Bhanumati Somabhai Ghiwala is working in obstetrical unit in SSG Hospital, Vadodara, with more than 30 years of clinical experience. She has undergone post-basic diploma in nurse practitioner in midwifery and is practicing respectful maternity care and promoting alternative birthing positions to mothers during delivery, and demonstrates leadership and commitment in midwifery lead care unit and is acclaimed by professionals and patients for her excellent services. She has managed deliveries efficiently during the flood time in Vadodara. Dr. Pragna P. Dhabi is working currently as Registrar in Gujarat Nursing Council. She has 25 years of experience. She is a National External Assessor for National Quality Assessment, Master Trainer for Oral Health Promotion, Member of Drafting Committee for Standing Operative Procedures of Gujarat Government Hospital. She has participated in Territory Army trainings. Dr. Pragna P. Dhabi has received many letters of appreciation. Dr. Mrs. Indira Jadhav Daniel has more than 2 decades of experience in India, serving as a teacher in school and college and administrator in hospital. Dr. Indira Jadhav started her career from GNM and has moved up to doctoral degree. During the hospital leadership, she was known for her exemplary contribution in providing care to the people of Ambala city. Her contribution during floods and other calamities in planning and organizing relief activities along with other health team members is significant. Srimati Vidya Bharanta, with 36 years of experience as Lady Health Visitor, has provided meritorious services in rural and backward or difficult areas. She is excellent cold chain handler, ASHA trainer, and a member of Kaya Kalp Committee. She attended many major accidents in the field and Chirgaon flood tragedy in 1997. She did outstanding work during plague epidemic in 2002. Srimati Aruna Kumari is a senior nurse for over 3 decades and currently working as in charge nurse. She is on deputation to NSCB Zonal Hospital, Mandi, Himachal Pradesh. She has served in various difficult and catastrophes such as bus accident and landslide very efficiently in Himachal Pradesh. She has participated in various blood donation camps and served as infection control nurse in Kaya Kalp program. Dr. Shaila Kani is working as Principal and Dean of SMVD College of Nursing, SMVD University, Katra, Jammu and Kashmir. She has 25 years of experience and has demonstrated dedication throughout. She has been selected to participate in the Global Nursing Leadership Institute for the International Council of Nurse Leadership Program 2018 at Geneva, Switzerland. She has carried out many research projects. She has presented various papers in workshops and conferences at national and international level. Srimati Asisan Kullu, with 22 years of experience, has worked in different clinical settings. Currently, she is working as nursing officer in RIMS Hospital, Bariatu, Ranchi, Jharkhand. She has undergone GFATM training and attended many continuing nursing education workshops. She has voluntarily participated in health camps in tribal area. Mariyamma MC A&M has 30 years of experience in both sub-center and primary health center in Karnataka. She is currently working in Nandugudi Primary Health Center, Hoskote Taluk. She has attended many training programs and workshops conducted by National Rural Health Mission at state central level. Mariyamma was awarded 2 times by National Rural Health Mission for her good work in implementation of national health programs. Srimati Gayatri Devi has 34 years of service to her credit. She works for old age homes and institutions caring for women and children and imparts need-based health education and counseling. Gayatri Devi has been honoured with various certificates of appreciation and awards from the Lion Club, the National Press Council of India, and the Newspapers Association of Karnataka awarded her Florence Nightingale Award. Smt Geetha P is a senior nurse having experience of over 3 decades. She has been working in cardiology unit of Government Medical College Hospital, Kozhikode, Kerala. She has worked during NIPAH outbreak. She has participated in flood relief operations in Kerala. Smt Geetha P has been awarded with Best Nurse of Kerala State 2019. Shri Muhammad Asif is a sincere, hardworking, responsible and dedicated senior nursing officer working in Community Health Centre, Andhra, Lakshadweep. He has a total of 26 years of experience. He provided nursing care for Indian Hajj pilgrims in Kingdom of Saudi Arabia at Makkah 3 months each time in 1998, 2006 and 2017. He actively participated in rescue operations in tsunami, Oki cyclone and Maha cyclone as emergency rescue team member. Srimati Rashmi Pandekar is a senior nursing officer who has worked in many clinical areas. She has 42 years of experience. She is currently working in MGH Government Hospital, Madhya Pradesh. She has done innovative work in maternity area by developing and using squatting chair for deliveries. Srimati Latha Sanjay Patil is currently working in the sub-centre Jalgaon Khurd in Maharashtra. She has 14 years of experience. She is excellent in health education and counselling of her patients and has significantly contributed towards achieving various targets under national health programs. Srimati Shalini N. Kumari is a senior nursing professional who has worked in various capacities and has a total of 35 years of experience. She was working as in charge sister in District Hospital Gadchiroli in Maharashtra. She is well experienced in handling emergency life-saving equipment. She has worked in emergency units in Naxal-afflicted areas and has worked in the area of organ donation. K Biaklun has more than 14 years of experience. She is working in a sub-centre at Manipur. She actively participated in the control of dengue and Japanese encephalitis outbreak. She is involved in many voluntary services such as caring for abandoned babies and elderly in home care centres and saved 2 children who were drowned in Tuitha River. Ms. Sagolsam Rama Maitai Janu is working in JNIMS Hospital, Manipur and has a total experience for more than 30 years. She was also posted in remote hilly areas while working in primary health centres. She has served people during outbreak of fire and saved many lives and property. Ms. Sagolsam Rama Maitai Janu has rendered outstanding services in both community and hospital and has received many certificates of appreciation. Lightmon Parsalan, with 20 years of working experience in difficult area of Meghalaya, has provided excellent services to her community under national health programs by travelling through rivers and climbing up the hills. She has been working in various sub-centres in the hilly district for the entire 2 decades. Lightmon Parsalan has received numerous letters of appreciation from Chief Medical Officer at Health Centre, non-government organisation and villagers for her outstanding committed services and for life-saving activities. Smt Vanlalthuami has worked for 28 years in various sub-centres, serving the community from remote areas of Mizoram without any public transport facility. During her service, she managed to remove manually retained placenta of a mother who bled profusely after delivery at home and saved her life. Smt Vanlalthuami has received various letters of appreciation for her dedicated services. Si Deng Thang Pui, with 38 years of experience, made significant contribution in providing maternal and child healthcare counselling services. She is working in Aizawl South Main Centre, a remote village in Mizoram, as health supervisor. She has received Best Direct Observed Treatment Provider Award by State Health Society, Tuberculosis Control, Directorate of Health Services, and appreciations for her exemplary work in saving a 13-year-old boy suffering from malaria in remote area who was unconscious for 7 days. Premlata Barak has 22 years of experience in rural community health field and is currently working in Community Health Centre, Kujong. Her performance in regard to national health programs is very well acknowledged and appreciated by concerned health authorities. She has contributed significantly towards achieving targets, particularly in institutional delivery and immunization. P Latha has 22 years of experience in rural community health field. She is currently working in a primary health center in Puducherry. She is a role model for budding nurses. Her efficiency in providing maternal and neonatal services has made zero maternal and neonatal death in her community after she has joined the primary health center. She donates blood regularly and is recipient of Best Blood Supporter from Uyir Thuli. Ms. P Latha has received numerous certificates of appreciation. In 2018-19, she was awarded Best A&M. K Anuradha has vast experience of working in cardiac units such as cardiac care unit and cath lab. With 20 years of experience, she is currently working as nursing officer at Indira Gandhi Government Hospital, Puducherry. Has also participated in rescue operation during tsunami and Thane cyclone. K Anuradha has received Best Nurse Award, an award for excellence in life-saving services by State Health Department. Ms. Satya Devi is working as staff nurse at Community Health Centre Shankar, Jalandhar, Punjab. She has undergone training in HIV/AIDS control, breastfeeding counselling and management techniques. She was a leader of Swachh Bharat team which helped the Community Health Centre to receive the first position in the state for Kaya Kalp 2019. Anita Vyas is currently working in the sub-centre Jalaur, Rajasthan. She actively participated in all national health programs and contributed significantly towards achieving targets. She has received 3 district-level and 2 state-level letters of appreciation and awards. In 2015, she was given the State Florence Nightingale Award. Has received appreciation letters for donating 49 times blood by Directorate of Health Services. Sunita Devi has 13 years of experience in rural health working in health centres of Rajasthan. She has provided excellent services with national health programs and health education. She has also received additional qualification in MA Economics and undergone training in information technology. Ms. Sunita Devi has received 5 district and 2 state awards for providing meritorious services and got State Florence Nightingale Award in 2018. Srimati O.V. Usha has more than 31 years of experience. She is currently working as an A&M in Government Peripheral Hospital KK Nagar, Chennai, Tamil Nadu. She has also worked in a sub-centre for 11 years, which covers a remote village. She has conducted 1,000 deliveries without any loss of life and inserted intra-uterine contraceptive devices successfully. She has received letters of appreciation for her meritorious services from health authorities at local level. S. Velankani, with 31 years of experience, has worked both in sub-centre and primary health centre in Villupuram, Tamil Nadu. She has participated in all the national health programs with Great Zeal. S. Velankani has been appreciated for her dedicated work in strengthening delivery of primary health centre services under Urban Health Centre in 2019 by MOHFW, GOI, and also applauded by Chief Medical Officer of Primary Health Centre in which she has been posted. Mrs. G. Mani Meghalai is presently working as a senior nursing professional with MSc Nursing qualification in Institute of Child Health and Hospital for Children, Egmore, Chennai, Tamil Nadu. She has 17 years of experience and has worked in primary health centre besides pediatric intensive care unit of a pediatric hospital. She is proficient in handling pediatric emergencies. Mrs. G. Mani Meghalai has been recognized as best nurse in her institution. Srimati Anna Parthi Aruna Kumari has extensively worked in rural community health field. At present, she works in Urban Primary Health Centre, Afzal Sagar, Hyderabad. She has participated actively in all national health programs and her significant contribution in achieving targets is appreciable. She has undergone many short-term training courses and workshops conducted by State National Health Mission and National Leprosy Control Programme. MD Shukura has 28 years of experience working in Primary Health Centre, El Kathurathi, Warangal District and Sub-Centre, Keshavapur, Telangana. Her services in the areas of maternal and child health, family planning, immunization, HIV/AIDS, tuberculosis, health education and counselling to the rural community are commendable. Numerous certificates of appreciation are being bestowed on her for her excellent work. Shri Asham Das is a very active nurse professional working in Thaibong village of Tripura. He is currently working in Sub-Room Subdivisional Hospital. He has contributed in the palliative care of 1,000 patients and screening of non-communicable disease. He has participated in cyclonic medical relief camps and disaster management awareness programs. Srimati Urvashi Dikshit is a dedicated professional and has been working in hospital as well as community. She is currently working as staff nurse in charge in District Hospital, Etawah, UP. She has participated in several community activities such as blood donation and eye camps with non-government organizations for welfare of children. Srimati Urvashi Dikshit has been appreciated by the hospital authorities for her efficient and outstanding contributions in improving the quality of the hospital. Srimati Kamala Thapa is a retired senior nursing officer with 37 years of experience. She was working in tuberculosis unit of Rajkya Mela Hospital, Haridwar, Dehradun, Uttarakhand. Srimati Kamala Thapa has received certificate of recognition at the local level for her meritorious services in the hospital and community. Ms. Sunita Datta, working as an A&M in a sub-centre, a tribal area in West Bengal, has provided excellent services. She has saved a pregnant mother's life in labour by transferring her timely to higher centre of care. She is very popular among children and school authorities for her active involvement in school health services. She has counselled many adolescents and their families about prevention of early marriage and gained fame in her work area. Ms. Sunita Datta is appreciated for her extensive meritorious services at local level by the health authorities as well as village community. Srimati Neelima Das is working as a public health nurse with more than 23 years of experience. She is currently working as public health nurse in Birpara SG Hospital, Alipurdwar, West Bengal. Besides her normal duties, Neelima has involved herself in many social service activities such as prevention of child marriage and human trafficking with non-governmental organizations. Srimati Neelima Das has been awarded as the Best Worker on Reproductive and Child Health Program of the SG Hospital at district level and has received many appreciation letters.